Ocala.
All right, 7 minutes after 11 o'clock. Thank you for tuning in. Dr. Peter J. Walter is our next guest. He is a board-certified physician, a urologist, a surgeon, and maybe his own patient as well. I don't know if that's possible. He had benign prostatic hyperplasia, and he's going to tell us what that is. June is Men's Health Month, and June 12th begins Men's Health Week. So we'll talk to Dr. Peter Walter right now. Good morning, doctor. Thank you for being on the air with us today.
Good morning. Thanks for having me.
The word benign is always a good word, isn't it, in medicine? When something says benign and then followed by whatever organ usually is good news, or am I wrong about that?
No, that's actually absolutely correct. It's a non-cancerous enlargement of the prostate. It stands for benign prostatic hyperplasia, and it's extremely common. It affects over 40 million men in the United States, and by age 50, it affects over 40% of men, and by age 80, it affects over 90% of men. So it's extremely common.
The cancer is, or the go ahead. The swelling.
Yes, the benign prostatic hyperplasia, which is the non-cancerous enlargement of the prostate.
Okay.
It's much more common than prostate cancer.
So what causes the enlargement, and is it often misdiagnosed as cancer?
It can share some of the symptoms of cancer, but when men develop urinary symptoms, it's more commonly due to BPH. The exact cause is, kind of has eluded us. It is associated with aging, and it is very common as we get older. Fortunately, most of the time when men develop these urinary symptoms, it isn't due to cancer, but they should still be checked for prostate cancer because that can produce similar symptoms. Some of the symptoms we see are things like a weak urinary stream, hesitancy or waiting to get started to urinate, stopping and starting of the stream, frequent trips to the bathroom day and night, and also potentially even some episodes of leakage, which can be very annoying.
Oh yeah, I would think so. So is it? It's sexual. It's a sexual organ. How do I ask this without sounding like I'm creepy? Is it a matter of use it or don't lose it? What use it or lose it? Is that part of this?
Yeah, it is actually a reproductive organ. So it actually produces semen fluid. A healthy prostate is also very important for a healthy sex life, and the problem with some of the treatments for BPH is that they can affect sexual functioning. Things like erectile function and ejaculatory function can be affected by some of the medications and some of the surgical treatments to treat BPH. So the prostate is intimately associated with our sexual health.
And that plays on the psyche, too, because the person can have emotional problems as well.
Oh, for sure. It's, sexual health is extremely important for men. And that's why, one of the treatments that emerged called the UroLift system is revolutionary in that it doesn't really cause any appreciable sexual side effects. There's no incidence of erectile dysfunction or ejaculatory problems, in direct contrast to a lot of the medications that we use to treat BPH and a lot of the surgical treatments that have been available to treat BPH.
Oh, really? Oh, so the treatment sometimes is worse than the condition?
Well, it's the old benefit-risk ratio. You want the benefits of treating the symptoms and maintaining a healthy bladder, because the bladder can actually be damaged if it's overworking to force urine through an enlarged prostate. So there's definitely a benefit to that, an important benefit. But whenever you're choosing a treatment, you also want to look at the side effect profiles. What's the risk that can occur with any treatment.
And this is something that's been studied for 5 years. We were made aware that your study encompassed.
Yes. There was the LIFT study, which recently put out its 5-year results. The UroLift system is a treatment for BPH where small implants are placed into the prostate to hold it open. So instead of going in and cutting tissue or burning tissue away or destroying it, it very gently places it to the side. So it's truly minimally invasive, and there's a rapid relief in symptoms and a rapid return to normal activity. And the really good thing about the study, about the procedure that the LIFT study showed, is that it's not just a temporary benefit. It's been studied for 5 years now, and the results that you obtain early on, the improvements are sustained for at least 5 years. A dramatic improvement in symptoms of about 36%, a dramatic improvement in the urinary flow of about 44%, and a 50% improvement in quality of life. And that's really important.
We'll talk a little bit about the infomercials we might hear, even a radio commercial, and they're selling supplements or herbal products to help with the prostate. Are any of them realistically going to help us? What are your thoughts on those things?
There was just a large review of the literature regarding these herbal supplements, and unfortunately, they were shown to not be more effective than a placebo. If you listen to those commercials clearly, they will say all the benefits, and then at the end they will say, this product has not been evaluated by the FDA. This product is not intended to diagnose, treat, prevent, or cure any illness. Mm-hmm. So they conclude the ad by saying, don't believe what we just said before.
And you are on both sides of the spectrum. You're not only a doctor that is treating this and doing the procedures, as you're a patient as well. So you have to have emotion on both ends of the fence.
Oh, for sure. I was very emotionally invested because, it was involving me. About a year ago, my urinary symptoms were really becoming unbearable. And I had to decide what treatment I would choose. Do I want to do medications? Do I want to do surgery? So I looked at the benefits and I looked at the risks, and I chose to have the UroLift system. And, it's been about a year now, and I remain very improved, and I remain very happy, and I have none of the side effects, in particular the sexual side effects, which, a lot of men my age might not want to talk about, but, we care about it very much.
You got to talk about it, especially if you're a doctor, or especially to your doctor. So what did you say, the UroLift system? I didn't quite understand the word.
Yeah, it's UroLift, UROLIFT. It's the system.
Okay.
Done. Yeah, it's a procedure done in the doctor's office, usually under local anesthetic, that very gently moves the obstructing tissue, prostate, to the side instead of going in and actually trying to destroy it.
Oh my gosh, that just seems like so much. It makes sense just in that little explanation. All right, thank you for telling us about that. Can I ask you to give us information so we can look into this further, maybe a website?
Sure, there is a website called UroLift.com, UROLIFT.com, and there is also a phone number, 866-362-3102.
Thank you, Doctor. Thank you for sharing that with us. You're welcome, Larry. My publicist just decided we were done.
Yeah.
We'll be right back.
Veterans are the foundation upon which our freedom is built. Listen to The Source, WOCA, each Thursday